Hey folks, I'm Dr. Drew Sinatra, and I'm joined today by my wife and colleague, Dr. Briana Sinatra.
Hello.
And we have this really exciting therapy modality that we'd like to introduce you to. It's a form of hydrotherapy, and it's known as the warming socks treatment. And it's a treatment that we've used at home on ourselves, on our kids, and our patients in the clinic. And we're always impressed by the results that we get. And basically, it's a modality or therapy that's used primarily during the fall and winter months to really help boost the immune system and to help counter the effects of the common cold and the flu and other respiratory conditions.
And so what it does is it stimulates your body to increase its circulation. The hot vasodilates and opens your blood vessels. The cold vasoconstricts and closes your blood vessels. And that facilitates a pumping action, which increases your full body circulation. It also increases lymphatic flow throughout your body, which helps to drain congestion in your head and lungs. So all you need are 2 cotton socks, 2 wool socks, and some water to wet the socks, a freezer to freeze the socks, make them nice and cold. So what you're gonna do is wet these socks. You can run them under a faucet, or right here I have a bowl of water, so you dip them in the water, wring them out really well. This is an important part. You wanna make sure that a lot of that excess water gets taken out, so I like to roll it in a towel. Make sure we get that excess water out. And then you want to place these socks flat in the freezer to let them freeze for a little while. Fill up your bathtub with nice warm water, as hot as you can take it. Put a little bit of Epsom salts in there, and I also like to bring in a tea with me. Hop in the bath, drink your tea, and essentially you want to be in there till you get nice and warm. This is the important preheating phase of the treatment. And in order for the treatment to be effective, you want to do this properly. So you want to stay in there for maybe 10, it can be up to 20 minutes. You want to get up, dry off, put your pajamas on, or maybe something a little even warmer, like some sweatpants or a sweatshirt with a hood, and then go get those frozen socks. So when the socks first come out of the freezer, they're going to be pretty stiff. Just give them a minute to thaw out. This one's already thawed a little bit, so you just slip that right on your foot. It's gonna feel cold, but then you replace it with that nice thick wool sock, and it already starts to warm up. You wanna repeat that same thing on the other foot. Cold sock, followed by nice warm wool sock. You then wanna hop into bed, bundle up, and try to go to sleep. This treatment also has a bit of a sedating effect, so people often report that they sleep deeper. So it might feel a little uncomfortable at first when you put those cold socks on, but they actually dry within a few hours. By the morning, they will be bone dry. If you do find that you start to feel chilled or those socks stay wet, it could mean one of 2 things. It could mean that when you were wetting the socks, you didn't wring them out enough and there's too much water still in that sock, or it could mean that you maybe didn't heat up your body temperature enough in that preheating phase. Some really great things about this treatment are that it can be used on very young babies through any age and even into adulthood. There's typically no contraindications. You can do it when you're pregnant, you can do it when you're nursing.
And sometimes one treatment is enough to really complete it, and other times you might need to do it for 2, 3, even maybe 4 nights in a row.
Essentially, if you can do it until you get a resolution of those symptoms, then that's the best, because you want to keep supporting that lymphatic flow, keep supporting that drainage, and keep supporting that circulation of those beneficial white blood cells to really help you get through that entire duration of that cold or flu.
Well, there you have it, folks. That's the warming socks treatment. We're very excited here to talk about this today. Give it a shot on your family and friends, yourself, during this fall and winter season, and you'll see how effective this treatment really is.
If you do try it, please feel free to share with us and let us know how it goes for you. And we hope that you have a healthy fall and winter season.
Take care.